Hi, I'm Duncan Stein, National Diabetes Foot Coordinator for Scotland. Today I'm here to talk about the CPR For Feet campaign. This is a national campaign which is supported by the Scottish Government. This campaign started off in life as CPR for diabetic feet for people who were admitted to hospitals. But we soon realised that there were many more at-risk people out there than just people with diabetes, and many other care settings that needed attention as well. So this campaign is now not CPR for diabetic feet, it is just CPR for feet, and it covers hospital settings and other care settings. So CPR for feet. What is CPR for feet? Well, it's a very simple system to make sure on admission to hospital or any other care setting, patients have their feet checked. If they are at risk of damage, then they are protected. And if they are discovered to have an existing problem, then they are referred appropriately. So what is it that we're actually trying to avoid? You'll see from these couple of pictures here, this is damage that may well have happened to patients in a care setting. And it is patients that have developed these, which we call iatrogenic harm, and this is avoidable harm that has happened to them during a stay in a care setting. So we need to prevent this because this is preventable. So why do we need to be specially concerned about the heel area? As you'll see from this picture here, the pressure and heels are the second most common, pressure ulcers and heels are the second most common after the sacral area. But why is that? The thin subcutaneous tissue found on the heel between the skin and bone provides very little protection from forces such as pressure, shear and friction, and that is why this area is extremely vulnerable for your patients. So who is at risk? The elderly, the frail, the immobile, bedbound, chairbound and malnourished. And what I would describe as special risks: patients with diabetes, patients with vascular disease, renal impairment, during surgery and post-operative patients. We need to be especially careful with these groups of patients. So recent guidelines in Scotland, NHS Scotland in partnership with Healthcare Improvement Scotland and the National Association of Tissue Viability Nurses for Scotland have developed the prevention and management of pressure ulcer standards, and these were updated in October 2020 and have just been re-released. And the key messages that you'll find from this document is the cost of prevention is less than the cost of treatment, and decreasing the incidence of pressure ulcer releases staff and resources and hospital beds and saves valuable budgets for everybody. So why do we need an initiative like CPR for Feet? Hospital or any other care setting, foot ulceration is what I would describe as unnecessary. It delays discharge, it's easily preventable, it causes unnecessary distress to patients, costs our National Health Service large sums of money and can result in litigation, and especially in these times we have to be very mindful of that. So the key to any successful implementation of any national campaign is that it has to be simple. It has to be kept simple. It has to be not time-consuming for frontline clinicians, because we know that there are major time constraints for all frontline clinicians. And it's best to integrate into current practice. It's much easier to integrate any new campaign which can be embedded into current practice. And it aligns with existing health agendas and priorities. And it is also very helpful if it is standardised across the country and in different care settings. So what have we achieved in Scotland so far with the introduction of this campaign? We have standardised the pressure redistribution products which are available via our National Distribution Centre. In the largest health board in Scotland, the percentage of feet checked on admission has risen from over 46% to over 96%. The application of pressure redistribution devices in individuals that are at risk of pressure damage has risen from 42 to over 70%. and the proportion of patients receiving a timely referral to podiatry has risen from just over 57% to 76%. So in all aspects of care that we hope to improve, and with the implementation of this campaign, we have demonstrated across the country. These figures are from one health board, but across the country we have similar improvements, which is very, very encouraging. So the new pressure relieving or pressure redistribution range approved for use in NHS Scotland. As I say, it was introduced via a clinical advisory panel process in consultation with infection control, tissue viability nurses, ward staff and podiatry. This is a legal process, and there was an award of a national contract. And the award of this national contract has proven to be lowering costs of the devices which are being fitted across the country. It has ensured the quality of devices fitted across the country, and they are evidence-based and clinically effective. And commitment to support each health board around the country with training has been part of the implementation of this contract and has been supported by the company who received this contract, which is tailor-made. So this will, with the introduction of this, will save us as clinicians valuable time and the health service a lot of valuable budget. So for the campaign to be effective, as I said, it has to be simple. It has to have a clear and understandable guidance. It has to be visually recognisable, and clear information and training has to be available to avoid any confusion. So CPR for posters and pressure relieving algorithms ensure that each ward or each care setting has one of these CPR for Feet posters and a simple pressure redistribution relieving algorithm. And these are very visible and very simple to follow. And if these can be in all care settings, then everybody involved in the patient's care will understand what needs to happen. So first of all, let's look at the HealSafe product, and this is for ambulatory patients. So this shows here this HealSafe fitted to a bed, and it is fitted over the sheet just to show how it is fitted to the bed, but normally this would be fitted straight onto the mattress, and then the fitted sheet would be put over this, and then the patient's feet are placed upon this. This product is very, very helpful for patients who are getting in and out of bed but are at risk of pressure damage, who don't have existing pressure damage, and they just need some pressure reduction or redistribution and not total pressure relief on an area that is broken or is very, very vulnerable. So it's a very useful product to use on these at-risk patients. So moving on to the patient who has an active heel ulcer or is at risk and non-ambulatory, we can fit them with a foot-safe boot. The advantage of this is this elevates the heel area and totally relieves the pressure from that area, which will aid healing or prevent breakdown in very vulnerable patients. The campaign is also supported with CPR for Feet badges. Now these are very informative badges, and they come with a lanyard which is attached to a double-sided card holder, so your any staff member's badge can go in one side and then the CPR badge can go in the other. On the reverse side of this badge there is a mirror which can be used to easily check patients' heels for any damage, and it saves any of the staff checking the patients having to bend down too far, so it's a great addition for able to check patients' feet. And it's a constant reminder also of the CPR campaign. So training. Training is very important so that everybody knows what is happening in your care setting. And if you're working in a hospital setting, I would say get buy-in from your chief nursing officer. Make sure the tissue viability department and the podiatry department and all the ward sisters are all involved in this campaign and know what's happening. Training, short, sharp training sessions carried out in the ward are very, very helpful. And encourage the culture of preventing and avoiding pressure damage, and encourage the use of the DATEX system in hospitals when damage does occur, but not to use this as a blame culture, but to use this as a culture of learning and preventing further damage. And remember, this is not just a hospital campaign, but is a campaign designed to cover all care settings. For hospital-based staff and NHS staff, there is a Learn Pro module. This was originally designed when this was just for patients with diabetes, so the module is called CPR for Diabetic Feet. And it gives an overview of diabetes and diabetes foot disease and risk for these patients. It's simple with good practical information and knowledge. It relies on case scenarios, and it covers the touch the toes test or the Ipswich touch test, which is a way of checking diabetes patients for neuropathy without the use of a monofilament. But if anyone has a monofilament handy and knows how to use it, that is absolutely fine. But the use of the Ipswich touch test, or touch the toes test as it's sometimes known, is a way of carrying out that neuropathy test without having a monofilament. There's also an online training resource which has been developed, and it's an educational tool for clinical and social care staff engaging with patients and patients at risk. And you will find this online resource at this web address. This was developed by the Scottish Diabetes Foot Action Group, working alongside and supported by NHS Education for Scotland. The learning outcomes from this site and the principal aims of this learning resource is to raise awareness of the importance of CPR for feet and how to apply CPR for feet to individual patients and clients in health and social care settings. It is case scenario based, it's context rich, and it's role and modelled on best practice. So think about introducing CPR for feet. Use the recommended pressure redistribution products to ensure quality and follow infection control guidelines. Prevent avoidable harm. Prevent litigation. Save valuable budget. And improve the quality of life for our patients. And really, when you look at all these aspects, especially saving budget and improving the quality of life for our patients and preventing avoidable harm, but this campaign has helped to contextualise what we should have been doing and is an aid to you as clinicians to aid you in carrying out your job and preventing harm to your patients. Thank you for listening.